All right, so next we're going to do Pre-Jowl Sulcus. Tips to thrive.
Tips to thrive in 3 minutes when treating the Pre-Jowl Sulcus.
Okay, ask me what I'm doing.
What are you doing, Stephen?
So I'm treating the Pre-Jowl Sulcus here.
Okay.
Great technique.
How do you choose to go in from here? Why not go posterior to, why not go lateral to medial? I like to go lateral to medial. You're going medial to lateral. Why?
Well, because as a surgeon, when we take down the mandibular ligament, we go medial to lateral. It's safer. And because it's safer, that's how I've always come at it.
Okay.
And also, I'm standing on the patient's opposite side. It's very easy for me to get under and manipulate and take down or get around that mandibular ligament. Now, it's a full ligament. It's a true ligament. It goes down to the bone, so skin down to bone. So you can't really disrupt that ligament, but you can certainly get product through around it.
So it's an osteocutaneous ligament.
It is an osteocutaneous ligament.
Okay.
But having said
do you really think that you're able to dissect it and maneuver it with a cannula?
No, but I'm going around it. I'm pushing through it.
Okay.
So I don't think that I'm subsizing it like I do the labiomandibular ligament, which is the orocommissure ligament. But I do believe I can get around it, underneath it. I think I can disrupt it a little bit, and I can certainly fill in that gap a little bit and make that Pre-Jowl Sulcus fill in a little bit, and you'll see a stronger, better looking jawline.
So here you're using a 22 gauge 70 millimeter cannula on a Nasha gel.
Yes.
And how do you know, and you're subcutaneous, it seems.
Well, so the skin goes down to the bone, so there's not a lot of space in there. So I work all around that mandibular ligament. So you'll see I go above it, below it, within it, even underneath it a little bit to fill in that area.
And here your goal is essentially, it seems like when you do that, you're helping blend the jowl in so that it doesn't stick out as much.
Blending the jowl into the chin. Now the key is the chin also has to look good because you don't want to get too round of a chin in a female especially.
Okay.
So I may have to put a little bit of, I put filler in the chin, project the chin forward, and then connect it.
Which is what you're doing here.
To the jowl, yeah.
Okay, so that you don't basically square out the face, which if you only just treat the Pre-Jowl Sulcus and you don't treat the chin, especially in a woman, then it looks wide and square.
Yes. And that is, the chin parameters for putting filler on the chin for a female is much more medial. You want to give a projection. I know that some people talk about staying within the
medial
canthi, or even the nasal, or even the nasal ala width, but much more medial. And the Pre-Jowl Sulcus is a great way to make patients look really good.
Yeah, you just did a really pretty job. So you deposited about 0.5 cc's in the Pre-Jowl Sulcus, 0.5 cc's with a cannula. 22 gauge cannula. Into the chin, just 0.3 cc's it seems like you put along the pegonia.
Oh, for the chin, yeah. You don't need much there. I go across. Some people go deep down to the bone.
That's what I do.
And do a Hershey kiss
with
out.
The needle.
And you're okay if you stay midline because 6 millimeters off the midline runs that
submental artery.
So you have to stay midline there.
Right, which is a branch of the submandibular artery, which is a branch of the facial artery.
Yeah.
And then here you also put a little bit into the mental crease.
Yes, sometimes I'll go into the mental crease as well if that's really deep. And it'll also support the lower lip, and it'll bring the lower lip up a little bit.
Okay, it brings it up because now it's supporting the depressor of the lip, the DLI.
Yes.
How are you avoiding getting into the inferior labial artery here?
So the inferior labial artery,
it runs in the sulcus almost 2/3 of the time.
It's deep here.
So you're superficial to it.
I'm superficial to it.
Okay.
And the submental artery is the one you have to be kind of concerned about because it's deep as it comes over the bone, but then it comes more superficial as you go superior. And I'm going horizontal, and I should be in a different plane than that artery.
Okay.
But 22 gauge cannula, that artery is pretty small. It'd be really hard to get in with this. But 22 gauge cannula, moving back and forth, using a Nasha technology here, but I'll also use Express technology, and I'll use Vicross also.
Okay.
I like Vicross along the jawline too as well.
Wonderful. Awesome. Yeah. So now you have 3 minutes how to thrive when treating the Pre-Jowl Sulcus, chin, and mental sulcus. So basically the chin complex.
There you go.
Bye.
Thanks for watching, and please hit that like button.
And make sure to click on subscribe so that you can stay most up to date on all things thriving.
Like me?
You need to subscribe.